Today is truly an historic day. Vaccinations have been a tried and true public health measure for hundreds of years, but the development of a COVID-19 vaccine is nothing short of revolutionary, and I hope everyone appreciates the importance, the significance, the history of this moment. We have our research community across the country and the globe to thank for their Herculean efforts to bring us toward the light of the end of this long and dark tunnel. And it's worth adding that we have people of color represented among the researchers who developed the vaccine, the scientists and doctors who reviewed it, and the tens of thousands of study participants who bravely volunteered so they could prove this vaccine's safety and its efficacy. So thank you to all of you. We couldn't have done it without you. But, and this is an important but, having a vaccine is only the first step. We must now move from vaccines to vaccinations. And it would be a great tragedy if disparities actually worsened because the people who could most benefit from this vaccine won't take it. I've often said vaccines are one of our greatest social injustices in this country. So ensuring that all Americans have an equitable opportunity to receive the vaccine and promoting vaccine confidence and equitable uptake will be critical if we want to save lives, ensure the protection of all Americans against COVID-19, and end this pandemic. We know that lack of trust is a major cause for reluctance, especially in communities of color. And that lack of trust is not without good reason, as the Tuskegee studies occurred within many of our own lifetimes. To truly combat vaccine hesitancy and encourage diverse enrollment in clinical trials, we must first acknowledge this real history of mistreatment and exploitation of minorities by the medical community and the government. Then we need to explain and demonstrate all that has been done to address these wrongs. The protections and safeguards in place, like the HHS, Office of Human Research Protections, and independent institutional review boards, and data and safety monitoring boards, to make sure tragedies like the Tuskegee syphilis study or the exploitation of Henrietta Lacks never happen again. And finally, we have to work hard to engage trusted voices, medical serving organizations like the National Medical Association and the National Hispanic Medical Association, the National Black Nurses Association, faith leaders, and community gatekeepers in minority communities to help build trust in the safety and the efficacy of the clinical study and vaccination process. I've worked with vaccine companies since August to ensure that we have diverse representation in the trials. And I've been working with historically black college and university presidents, including DC's own Howard University, athletes and influencers, pastors, rabbis, and imams, and more to educate our most vulnerable about the safety and the efficacy of these vaccines. And HHS, under the direction of Secretary Azar, has a vaccine consultation panel that gives us feedback and serves as connection points, educators, and megaphones to communities of color. But while we begin today administering the first doses of this remarkable vaccine to the people and places where it will be most immediately impactful, we must keep following the 3 W's until we achieve widespread distribution and uptake of COVID-19 vaccinations. Remember to wash your hands. I'm going to demonstrate it right here for you. Remember to watch your distances. And remember to continue wearing your masks. Be concerned about rising cases and deaths, and therefore cautious in your day-to-day actions. But also be confident. The finish line to this marathon is in sight. And remember that we can't finish the race without each and every one of you. Help reduce the burden on folks like the clinicians here with us today getting their vaccinations, and by following the 3 W's and getting your flu shot now, and by getting vaccinated against COVID-19 as soon as you're able. I just want to finish by thanking you, Secretary Azar, for your incredible leadership throughout the development and distribution of the COVID-19 vaccine, and for always pushing HHS to address disparities and diversity as we tackle this pandemic. As you've often said, we should be proud on this day, but we should also be doggedly persistent in pursuit of equity and an end to this pandemic. And with that, I'd like to turn the podium over to you, Secretary Azar, for your remarks.
Well, thank you, Admiral Adams, for being here today, and thank you for your constant leadership in promoting the value of vaccination at this time and over the last several years. I want to thank the team here at GW for welcoming us here today, and to Mayor Bowser for joining us and for her partnership throughout this crisis. We're here today because of the extraordinary medical achievement that our country has delivered this week. Through President Trump's Operation Warp Speed, substantial quantities of a safe and effective vaccine within a year after the virus was first known to the world. Today, healthcare providers across America are going to work to administer vaccines to the most vulnerable and to fellow healthcare workers. Here at GW, we are marking a ceremonial kickoff to this national vaccination program. What we'll see here today is representative of what's happening across America right now. What you see here today is also a reminder that as exceptional as Operation Warp Speed is, administering vaccines is something our healthcare system knows how to do very well indeed. Our hospitals, pharmacies, and other healthcare delivery sites administer more than 100 million flu vaccines every year. Here at GW, the COVID-19 vaccine is being administered to employees essentially just like the flu vaccine is. I also want to praise the thoughtful work that GW has done to determine how to allocate early shipments of vaccines among its team, analyzing data about which healthcare workers are at greatest risk for contracting the virus and which are at highest risk for serious outcomes from the disease. States and communities across the country, like D.C., can use data like this to make the right decisions for how to allocate vaccines, using the recommendations of experts, their own best judgment, and their views on their own local situation. We're also here, and I'll be at many vaccination sites in the coming weeks, to underscore that receiving the COVID-19 vaccine, as exciting as it is just like getting any other safe and effective vaccine that Americans receive to protect us from illness. I was pleased to see a new ABC poll released this morning, finding that more than 8 in 10 Americans say they plan to get the vaccine. But we still have more work to do in educating Americans about the safety and efficacy of these vaccines. This FDA-authorized vaccine and each COVID-19 vaccine that FDA potentially authorizes will have been through the typical numerous stages of safety review and more. This vaccine has gone through clinical trials much larger than many vaccine trials. It's gone through the drug company's checks. It's gone through an independent data and safety monitoring board. It's gone through the FDA's independent advisory committee. It has been subjected to FDA guidelines publicly published stating what FDA would require for approval. And finally, it has been authorized by FDA's career scientific experts, as I promised. At 95% efficacy, this vaccine is extraordinarily effective at protecting you from the virus. Getting vaccinated will help keep you, your family, and your country healthy and safe.